Hello, this is Kim Newman. I'm just here to do my health assessment, and I'm just going to show the 360 surroundings of the working field here. And I will let my participant introduce themselves, and then we'll get started.
Hi, I'm Sam Comer, and I consent to this video.
Hello, I'm Kim.
Hi,
And what's your name?
Samantha.
Okay, so I'm the nursing student with Nipissing University. I'm going to be your nurse for this evening. And what is your last name?
Comer,
Okay, and your birthday?
January 27th, 1994.
Okay, I'm just going to compare on your wristband. Perfect. So I got the right patient, and that's been verified. So before we get started, just going to perform some hand hygiene here. So today, Samantha, I'm going to be just doing an assessment of your lungs and your heart. Okay? Okay. So is there any health history that I need to know about?
Nope.
Any allergies?
Nope.
Are you taking any medication?
Nope.
Okay. So from my exam, there's no, well, we're going to start with your heart exam. And I don't see any jugular vein distension. I don't see any visible heart palpitations. Her skin color is within normal ethnicity. I don't see any redness or rashing. I don't visualize any lumps or bumps. And do you have any chest pain?
Nope.
Do you have any history of chest pain?
No.
Any cardiac issues or procedures or family history?
Nope.
Any dizziness or fainting spells?
A long time ago, but not recently.
Okay. And that wasn't heart related?
No.
You know of? Okay. So we'll get started here. And so I'm just going to feel around your chest here. Just going to palpate, feeling for lumps and bumps, seeing if I can feel any physical vibrations here. Okay. And I'm going to just feel down, and her skin is warm. I'm going to feel at her radial pulses here. I'm going to do it bilaterally to assess and compare between the two, which they are 2+, they are normal and present, and they are regular. If there was some weakness or if I couldn't feel it, then I could move up into the brachial. And then I also am going to just assess the other pulses here. So I'm going to assess her pedal pulses here, which again, bilaterally, they are regular, they are 2+. And if I did not feel or there's some weakness, I could move up into the popliteal or even in the femoral. I'm also going to visualize any edema, which it does not look like there's any swelling. There's no pitting edema. Her limbs are warm, and they're good. So now we'll go on into the heart assessment here. So I'm just going to take my stethoscope and place it on certain spots on your chest, okay?
Okay.
So I'm going to feel at the clavicular line here and feel down into the second intercostal space. And I'm going to start at the right side, which is my aortic valve, right of the sternum, second intercostal space. And I'm listening for that lub-dub sound, which the dub is going to be a bit louder, and that's a normal finding. And then I'm going to cross over, remaining on that second intercostal space, left of the border this time, into the pulmonic valve. And again, it is regular. I'm going to move down into that third intercostal space at the Erb's point. And I hear that lub-dub, S1, S2, very well, and it is regular. Going to go down into the fourth intercostal space. And this is where I'm going to be at my tricuspid valve. And it sounds regular. I'm going to head down into my mitral valve region. And this is at the midclavicular line at the fifth intercostal space. This is also where I will be performing the apical pulse. And it does sound regular. Just got to get it on my watch here. Okay, I'm gonna listen for a minute. Okay, and her pulse is 66 and it is regular. And I'm now just going, I did not hear any S3 or S4 sounds. It all sounded regular throughout each area of the heart. I'm just going to listen with the bell here just to make sure there's no murmurs, no other sounds such as the S3, S4. So again, I'm just going to listen down, feel down to that second intercostal space. And using the bell, I can listen for low pitch noises and those other sounds. Okay, I'm going to go left of the sternum to that pulmonomic valve. And down to the Erb's point, third intercostal. And going down to the fourth at the tricuspid valve. And then back at the mitral valve here. And I do not hear any murmurs or any S3, S4 sounds. I also will just listen for any bruits. Okay, so the cardiac, the heart, we are finished with that. However, I forgot to take vital signs at the beginning, so I'm going to do that now. So, Sam, typically at the beginning of my assessment, I will do the vital signs. So here we go. I'm going to put the blood pressure and your oxygen on. Here's your temperature. And now my patient's readings is 36.6. Her pulse was 66. Her respirations were 16. Her blood pressure 120/80, and her oxygen was 100% on room air. Again, this normally would be done at the beginning of the assessment. Okay, so now I'm going to move on to your lung assessment, Samantha. So on my inspection, again, her skin is within normal range of ethnicity. I don't see any redness, no rashiness, no swelling. Her rate is normal, symmetrical. I don't see any use of accessory muscles. I don't see any use of the trapeze muscles, no neck usage. There's no retractions. Her breathings are unlabored and diaphragmatic. She's using her diaphragm to breathe. Do you have any shortness of breath?
Nope.
Any difficulty breathing?
Nope.
Any COPD?
Nope.
Any asthma?
I do actually have a history of asthma, but it hasn't been a problem for a long time.
And you don't use puffers? No. And any family lung issues?
Not that I know of.
And are you a smoker?
Nope.
No. So overall, seems healthy. So now I'm just going to palpate here. Again, feeling for any lumps, bumps, feeling her skin is warm. There's no cyanosis at the mouth, or open your mouth. No cyanosis present. I don't feel any subcutaneous emphysema anywhere. Let me see your nail beds there. And so they are pink. Cap refill is less than 2. And it looks well. And again, I can look at the lower limbs and I can assess and do the cap refill as well. We already assessed for swelling and there was none present. And now I'm just going to feel on your chest here. If you can just take a big deep breath in. And good, it is symmetrical. Chest has risen and fallen equally. Now I'm just going to do that again down here. Just take a big deep breath. Good, expansion as well and symmetrical. So now I'm going to just listen to your lung sounds. So every time I place the stethoscope on, just take a big deep breath. Sometimes with the big deep breaths, our patients can become dizzy. So if you have any dizziness, just let me know and we can take a break, okay?
Okay.
Okay, so I'm going to start at the clavicle line here and just assess for the apex of the lungs here. So just big deep breaths. Good. Good. I'm going to go down to the second intercostal space at the upper lobes. Good. And we will move down to about the fourth here. On the right side, there is the middle lobe there. So we're assessing that middle lobe. And then that upper lobe of the left lung at the fourth intercostal space, which they sound clear bilaterally. Then we'll get to the fifth intercostal space somewhere. Or the sixth intercostal, I should say. Good. And the lower lobes, they sound clear bilaterally. Rate, rhythm, and depth is continued to be equal and symmetrical. There is no abnormal sounds, such as those wheezing, crackles, pleural rubs. Everything sounds regular. So now we will move on to the posterior of your lung assessment here. Again, while I'm here, I'm just going to assess. I'm going to be feeling any lumps, bumps. Take a deep breath. It is symmetrical, no accessory muscle use, no retraction. I'm just going to feel the vibrations on each side. Samantha, if you can just say 99 each time my hand places.
99, 99, 99, 99, 99, 99.
Okay, and those were equal. I felt vibrations equally on each side. Now I'm just going to start here at the apexes again. If you just, once again, Samantha, take big deep breaths every time you feel this on here. And again, we can stop if you feel dizzy. All right, let's start. I'm just going to work my way down, listening to the upper fields or upper lobes here. And I'm going to listen to them bilaterally to compare each side.
Oh, made me yawn.
We'll take a moment for that yawn. And there is good air entry and air exit on both lungs. And then we're just reaching down into our lower lobes here. Good. Then we're going to go to the bases of the lungs. Good. And again, the air intake and exit, it was clear. There's no adventitious sounds, no crackles, no pleural friction rubs, no wheezing. Everything seemed normal. And I think that would conclude my assessment. I thank you very much for participating. Do you have any questions for me?
No, I don't think so.
Okay. Yeah, overall, her heart assessment was normal. S1 and S2 was present. Her lung assessment was normal. The rate and rhythm was normal, symmetrical. There was no abnormal sounds from the heart or the lungs. So based on my assessment, I would rule this as a normal, healthy assessment. Thank you for watching and thank you for participating.